Hello, I'm Sheila Davies, Director of the Dare County Department of Health and Human Services. I would like to provide you with updated information regarding COVID-19. In North Carolina, there are currently 15,346 cases of COVID-19 in 99 counties. There have been 577 fatalities in North Carolina associated with COVID-19. Currently, the state is reporting 475 hospitalizations across the state from COVID-19 illness. Dare County received 3 new positive COVID-19 test results over this past weekend. All 3 of these individuals who tested positive are Dare County residents and acquired the virus by direct contact. One of the 3 individuals is currently hospitalized out of the area, and the other 2 are recovering in home isolation. All individuals who are identified as being direct contacts with the individuals who tested positive have been notified. The number of positive COVID-19 tests in Dare County is 21. Of those 21, 16 have recovered or are asymptomatically cleared, 1 died, and 4 are active. Active means an individual currently has the COVID-19 virus and is being monitored daily by the health department. Of the 4 active cases, 1 is hospitalized and the other 3 are recovering in home isolation. This includes the individuals who tested positive this past weekend. Each day, 7 days a week, we update the COVID-19 case counts for Dare County and North Carolina on the Dare County website. This data now includes the active count. For the most up-to-date information on COVID-19 cases, visit darenc.com/COVID19. I will now provide trend updates on the 4 key metrics we are tracking as part of our disease investigation and surveillance. This trend data provides information on the intensity and spread of COVID-19 in our community. Because data has limitations, no one metric should be viewed in isolation. The 4 key metrics we are tracking are weekly number of tests, laboratory confirmed cases, positive test as a % of total test, and COVID-like illness surveillance. We will continue to update the data for each of these key metrics on a weekly basis and share this information in Tuesday videos. For weekly number of tests, is Dare County seeing a change in the number of COVID tests being reported each week? This graph shows the number of tests being reported in weekly increments. 498 COVID-19 tests have been reported to Dare County through May 10, 2020. The number of tests continues to increase over time. 74 tests were reported this past week. As indicated last week, the graph also shows a significant increase in the number of tests reported during the week of April 6th through the 12th, which is when the mass testing of peak residents and staff occurred. Some limitations with this metric include commercial lab companies are not required to report the number of tests conducted for communicable diseases, including COVID-19. However, they are required to report any positive results. We are working very closely with the healthcare providers in Dare County who are testing for COVID-19 and have daily discussions on patients who are being tested. Additionally, the current testing guidelines for providers in North Carolina are for tests to be performed on symptomatic individuals in whom COVID-19 is suspected, or individuals who have had direct contact with an individual who is a laboratory-confirmed positive test for COVID-19. We are working with the state regarding plans to increase community testing throughout North Carolina and in Dare County to make testing more widely accessible. I hope to have more information on this initiative by next week. Laboratory confirmed cases. Is Dare County seeing a change in the number of laboratory confirmed cases of COVID-19? This graph shows the laboratory confirmed cases by date. Dare County saw an increase of 3 positive tests this past week. Please note these numbers reflect only laboratory confirmed cases and not all people who have or had COVID-19. We will continue to report all positive cases, even those who do not have a Dare County permanent address. We have been doing that since the beginning, which is why our current case count does not match the case count on the NCDHHS website. Positive test as a % of total test. Is Dare County seeing a change in the trajectory of positive test as a percentage of total test? The number of COVID-19 tests being reported has been increasing over time in Dare County. As testing increases, there may be more laboratory confirmed cases. Looking at what % of total tests are positive helps us understand whether laboratory confirmed cases are increasing in comparison to the number of tests conducted. This week, we received positive test results on 2 separate days, as indicated in the chart. A limitation with this data is our relatively small number of positive cases and the gaps in time between positive cases. Based on our current data, this chart does not provide an overall picture of any trends for Dare County. It will be important to monitor this trend over time in light of our population growth. COVID-like illness surveillance. Is Dare County seeing a change in the number of people presenting in the emergency department with COVID-like illnesses? In North Carolina, we receive emergency department data in near real time using the North Carolina Disease Event Tracking and Epidemiologic Collection Tool, NC Detect. This is an effective way to track respiratory illness, including COVID-19. As you can see from this graph, the percent of emergency department visits with COVID-19 related symptoms was mostly flat this week, with only a small percent of patients presenting to the emergency department with COVID-like symptoms in the middle of the week. The limitation with this data is that it only represents people seeking care in the emergency department. We are in close communication with our area urgent care centers and work with them daily on syndromic surveillance. In closing today, I want to remind everyone to practice the 3 W's to continue to slow the spread of COVID-19: wear, wait, and wash. If you leave home, practice your W's. Wear a cloth face covering if you will be with other people. Wait 6 feet apart and avoid close contact. And wash your hands often with soap and water for at least 20 seconds, or use hand sanitizer. There are a lot of discussions about cloth face coverings. In alignment with the CDC and North Carolina Executive Order 138, we are strongly recommending that people wear a cloth face covering when they leave their house, or maybe less than 6 feet away from other people who are not family or household members. Covering your face is about helping others. By covering your face when you go out for essential reasons, you are being a good neighbor and community member. There is growing evidence that COVID-19 can spread between people in close contact through actions like coughing, sneezing, and talking, even when they are not showing symptoms. Wearing a face covering is another step that may help reduce the spread, especially those who may not know they're sick. Face coverings are not a replacement for other evidence-based measures, such as physical distancing, frequent hand washing practices, and remaining at home wherever possible. We encourage you to stay informed by visiting darenc.com/COVID-19 or by visiting the CDC or NCDHHS websites. If you have specific needs or questions, you may also call the Dare County COVID-19 Call Center, open Monday through Friday from 8:30 a.m. to 5 p.m. at 252-475-5008. Thank you.